So as we move forward, we look forward to continuing to work together and find new ways to improve quality of care delivery across Ontario. And with that, I'm pleased to introduce Minister Sylvia Jones to deliver today's announcement.
Thank you, Sonia, and thank you for saying partnerships, because none of this would happen without partnerships. Good morning, everyone. It's wonderful to be here at St. Mike's Hospital in Toronto, along with my colleagues, Minister Jill Dunlop, Colleges and Universities, and Parliamentary Assistant Don Gallagher-Murphy, and of course the CEO of Ontario Health, Matt Anderson. I'd also like to acknowledge some of our incredible partners in healthcare who have joined us today. Kim Moran from the College of Family Physicians, Justin Bates from the Ontario Pharmacy Association, Anthony Dale from the Ontario Hospital Association, and Chantel Sorhendo from the Nurse Practitioner Association of Ontario. On behalf of Premier Ford and our entire government, thank you to each and every one of you and the team here at St. Mike's for your work to improve healthcare access across Ontario. Over the past several months, I've traveled across Ontario to the front lines of our healthcare system. I've seen the delivery of world-class cancer care in Toronto, life-saving pediatric care in Ottawa, state-of-the-art mental health care in Penetanguishene. And I have had the opportunity to meet and speak with many of our dedicated healthcare workers across Ontario. But I've also seen that our healthcare system and our healthcare workers are under incredible pressure. And for too many people, healthcare is too hard to access. The status quo is not working. Ontarians deserve to be able to get care where and when they need it. This means more hospital and long-term care beds in our communities, more diagnostic testing, like MRIs and CT scans, closer to home, and more skilled healthcare workers available to provide care. We need to be bold, innovative, and creative. We need to build on the spirit of collaboration on display across the healthcare sector. We need to have the courage to look to other provinces and countries and borrow the best of what the world is already doing. And we need to be clear. Ontarians will always access the health care they need with their OHIP card, never their credit card. Under Premier Ford, that will never change. That is why today our government is pleased to introduce Your Health, a plan for connected and convenient care. Our goal is to make healthcare more convenient for Ontarians by connecting you to care closer to home. This plan lays out a broad series of initiatives under 3 pillars, which are designed to work together and work for people. The right care in the right place, faster access to care, and hiring more healthcare workers. Building on progress already made, this plan will strengthen all aspects of healthcare right in our own communities, in hospital emergency rooms, in community settings like pharmacists, pharmacies, and doctor's office, in long-term care homes, and through care delivered in the comfort of your own home. Some of these changes will happen immediately as we take action to address pressing issues. Other changes will take time. They will be phased in over the months and years ahead as we educate and graduate new healthcare workers, build new hospitals, community surgical and diagnostic centers, and long-term care homes, and deliver care in new and innovative ways. Over time, you will see and feel real improvements in the care you receive as we build a better healthcare system for the future. You will have more information and better tools to make the right decisions about your health. It will become faster and easier for you to connect to the health services you need in your community or at home, no matter where you live. You will experience shorter wait times for key services like surgeries, emergency care, and supports for mental health and addictions. Your healthcare workers will be set up to work together as a team for you, making it easier for you to navigate care at every stage of your life. Some parts of our plan you can now visit pharmacies across Ontario to receive treatment for 13 of the most common ailments without a doctor's appointment at no extra cost. Paramedics can now treat certain people who call 911 at home or on scene in the community rather than taking them to an emergency room. More surgical centers will start offering publicly funded cataract procedures to eliminate the current surgical backlog and reduce wait times. This plan will create a Models of Care Innovation Fund for individual hospitals, long-term care homes, home care providers, and that want to find innovative ways of maximizing the skills and expertise of their current health workers. We are also investing $30 million to create 18 new interprofessional primary care teams to help bridge the gap in accessing primary care for the vulnerable, marginalized, and unattached patients to ensure they are able to connect to care where and when they need it. We are also moving forward with medical school expansion plans, training more nurses, adding training positions for physician assistants, allowing Canadian healthcare workers to come work in Ontario quicker, and adding more education spots for nurse practitioners. This is all in addition to the work our government has already done. Since 2018, we have increased healthcare funding by $14 billion. We've added more than 3,500 hospital beds across Ontario, including more pediatric critical care beds. We're getting shovels in the ground for 50 new major hospital development projects. We're providing operational funding for 49 new MRI machines in hospitals. And we are on track to build 30,000 new long-term care beds by 2028, all while growing our healthcare workforce by 60,000 new nurses and 8,000 new physicians since 2018. With this plan, we are continuing to take significant steps forward because we know the status quo is not working. There are some who will fight for the status quo no matter what. They're ideologically opposed to change and improvements. We won't accept that. We cannot accept that. People want better health care. We are preparing for the future by putting aside the ideas of the past because your health matters. Thank you for being here. Stay well.
Thank you, Minister. We'll now move to questions from the media. As a friendly reminder, it's one question on the call.
Hi, Minister. We're heading into the federal provincial healthcare meeting next week, and I note the stuff on the back page about Ontario being in full support of the federal government's call for national healthcare data reporting. So I know some provinces are ahead of us. Alberta, for example, measures wait times by individual surgeon, which I don't think we do. So I'm wondering, in a practical sense, if you can give us some details of what Ontario needs to get up to speed on to be part of a much more comprehensive and better national healthcare reporting system.
Yeah, I have full confidence that Premier Ford is going to be able to articulate, as he has for many, many months, the need for Ontario to move from that 22% to 35%. We've always been very open with our federal partners that if they need the data to prove that the $14 billion that we've invested since 2018 is improving our system and making it better, we're all in. We are doing that with the help of Ontario Health, and we'll continue to make that information publicly available, but obviously available to the federal government as well.
In background talks leading up to the feds leading up to this, so are you getting any indications of what they're trying to pull together? Like how, can you give us some specific examples on what we need better data on?
Yeah, I don't think that it's appropriate to sort of start to negotiate outside of what will happen next week. Look, the provincial and territorial health ministers have been very strong. The first ministers have been very strong in that 22% needs to move up to 35%. The vast majority of people believe that it's a 50-50 partnership. Unfortunately, it is not. And we as governments, as provincial, territorial governments, are making those investments. We just want a willing partner to help with that investment on the health side. Thanks.
Morning, Minister. Liam Casey with the Canadian Press. I don't know if I haven't seen it in here. I'm just wondering what the plans are to help children's hospitals with their surgical backlog, which stands around 12,000 children.
So there's been lots of work happening on the pediatric side, of course, with the RSV surge that we saw in November and December. Lots of participation with other community hospitals being able to assist to ensure that children who were able to be looked after in their community hospitals could do that, as opposed to being transported to some of our pediatric hospitals. We have actually expanded the number of pediatric ICU beds that are available in the province of Ontario. And, you know, I have to give a shout out. A lot of that work happens with the work of Ontario Health and hospitals that are willing to be part of the solution. So we're seeing a stabilization, which is very good news in the pediatric piece. We will continue to work on the backlogs because we understand how stressful that can be for parents and caregivers.
And many hospitals have told me they've called for a centralized waiting list that could help out the surgical backlog. Just wondering, are you considering that? Is it part of this plan?
Yeah, so there's lots of work that we are doing to coordinate where services are available, where there perhaps has some additional opportunities for surgeries or even ICU beds. We did a lot of that work during the height of the pandemic. And again, I have to give a shout out to Ontario Health. The hospital partners who were able to accept patients, and that coordination piece really made a big difference in making sure that people got the care they needed. Ultimately, we need to build the capacity. And we're doing that with, as I said, 50 new capital builds, whether those are new hospitals, expansions, or renovations. So there's lots of pieces that are building the capacity, but in the shorter term, we're also seeing much more partnerships and continuing on that pathway, so that if there is capacity in one part of Ontario that can help out in another, we're doing that work through the leadership of Ontario Health.
All right, and this will be our last question.
Hi, Minister. Mark Liverman with CP24. Just wanted to readdress a question that had kind of been brought up in the early stages of this announcement a couple of weeks back, which the concern that at least some Ontario residents have when it comes to upselling at a lot of these clinics, when it comes to, like, when they go in for cataract surgery, upselling, things that would then end up being paid out of pocket and not being covered by OHIP. That's a concern that some Ontario residents do have.
So a concern that I hear is I'm waiting too long to get the cataract surgery that I need and want. You will see in your health that our cataract surgery wait times in the province of Ontario is not a good news story. It is, frankly, why we invested immediately in Windsor, in Ottawa, and Kitchener-Waterloo in existing capacity so that people could get those cataract surgeries faster. If there are surgeries that are done that are cataract surgeries appropriate, they will be covered by OHIP. There are additional offerings that hospitals and community surgery centers provide and make available, but they are not mandatory, and they will, the core service will be covered by your OHIP.
Provide some examples on those additional offerings that would be not covered by OHIP?
So I'm not a clinician. What I will say is those are individual conversations that the surgeon have with their patient, saying, these are your conditions, this is what is covered. With your OHIP, you will get that cataract surgery, and because you have ABC condition, you may want to, but you are not obligated to have this additional offering. Thank you.
Perfect. That concludes our event. Thank you, everyone, for